Hello, I'm John Hammond with Governor Eric Holcomb's office, and I want to welcome everyone joining us virtually on behalf of the Commission on Improving the Status of Children for this really exciting what's become an annual event. And I first would like to read on behalf of the Governor proclamation that he has signed as is tradition, and then I'll say a few remarks and hand off the stage. So thank you for joining us. Excuse the whereas clauses. Whereas Indiana is home to 1.56 million children under the age of 18, and children are both present and the future of the Hoosier State, and whereas children thrive in families, communities, and states that care about and work for their well-being, and children struggle when their physical, emotional, and educational, social, or economic needs are unmet. And with awareness of children's needs and strengths, all Hoosiers can play a part in ensuring the success and well-being of the next generation. Now, therefore, I, Eric J. Holcomb, Governor of the State of Indiana, do hereby proclaim January 26, 2021 as Day of the Child in the State of Indiana, and invite all citizens to duly note this occasion. And again, thank you for being here. This, like I said, is an incredible partnership with the Indiana Youth Institute, who you'll hear more from, who's really driving the gathering and publication of this incredible, really, third-party validation data that drives so much of the work of this commission. And we've just really appreciated the partnership. Over the years, I was sharing before this, we use this as a reference, as a guidepost as we start our work for this year. I happen to be the rotating commission chair, and I was reminded that I was doing this same thing from a different podium with people in the room, in the rotunda, in 2017. So really happy that we've been able to keep up this partnership, and just wanted to underscore from our vantage point, obviously on the Commission Improving the Status of Children, we have a lot of agencies represented, and one thing that we've tried to do in all of our agencies to drive outcomes is to have good data. Data is everything, and this is the work of the Indiana Youth Institute and the Commission to use that data to continue to dig deep, and outcomes for children, youth, and their families is the most important work I think we're doing in the state, and so I'm just happy to be some small part of it. We were happy with what we've seen as a result of the focus on children and some of the data we've seen at the Department of Child Services, and I'll just brag, the governor mentioned some things in the state of the state, the rate of children going down by nearly 30% in care. This is a team effort, many different agencies, but obviously that no one that we can appreciate more than Terry Stigdon helping with that. The incoming rate of children coming into care for the state is down 34%, and then of course the stability of the workforce, the safety net for the children and the families, our family case managers and their supervisors. Turnover was an issue, and now down over 30% as well. And so we're really proud of just that small, and so we measure that data, but we're not satisfied. And so this is the next step to try to make sure that we continue to advance the ball for all those key constituencies and those that really need our help. So thank you. I'm going to now hand it over to Tammy Silverman, who will take us through the rest of the program. Thank you.
Well, thank you so much, John, and thanks to the members of the Commission on the Commission on Improving the Status of Indiana. Usually that rolls off the tongue, so I apologize for that, and particularly the Executive Director, Julie Whitman, who they've all been, and Julie in particular, has been an extraordinary partner for this, our 4th annual State of the Child Address. Thank you to Governor Holcomb for proclaiming today the Day of the Child. And perhaps even more importantly, for that continued dedication to our children and the services that support them. We want to say thank you to all of our many state partners, including, but certainly not limited to, here's a list, FSSA, IDOE, DWD, DMHA, IDPH, IDOC, JDAI, lots of alphabets, but we know that the data that's in this book would not be possible without your contributions and collaboration in creating the data book. Our ever-growing network of partners and collaborators only strengthens the data, and it also strengthens our shared efforts to increase the well-being of our kids and youth. Last but certainly not least, never least, is thank you to all the youth-serving professionals across our state. These are the individuals that dedicate their professional lives to protecting, teaching, and serving our state's children. Today, we are absolutely delighted to bring you the highlights. It's just the highlights. The book's very long and detailed. It's the highlights today of the Indiana Youth Institute's 2021 Kids Count Data Book, which is our 27th edition. As we all know, this year has been unlike any other, and in response, this Kids Count Data Book is also a little different. COVID-19 has negatively affected most, if not all, of the programs and services aimed at helping our children and youth, which includes but is not limited to our schools. Economic and societal disruptions will likely affect the health and well-being of many of our kids for some time to come. While much of the data reflects pre-COVID circumstances, in this year's data book, we're also highlighting many of the pandemic-related effects that we're already seeing. Some of those include increasing levels of stress and depression amongst youth, decreasing math proficiency on formative assessments, increasing housing and food insecurity, and delayed or missed preventative health care. Most of you out there already know the degree to which this is affecting our kids. This year has also given us painful reminders of the history and ongoing effects of institutional racism in America and in our state. The data shows racial disparities in most of the child well-being indicators, including wealth, physical and mental health, involvement in the juvenile justice system, employment, housing stability, and educational attainment. Our data book this year connects the disaggregated data to historical context, policies, and resource gaps influencing the outcomes of historically marginalized Hoosier youth. We deeply believe that a better understanding of the realities facing our children of color empowers us to work together to build equitable solutions. The data can help us understand and work together to develop potential solutions for these complex problems. We all have a shared responsibility to do more for our kids. As you heard earlier, they're our present and our future. We must continue building those ever stronger networks of community partners so that we can create actionable next steps. We thank all of our existing partners. We invite new collaborations, and we look forward to working together to ensure that all of Indiana's children are safe, healthy, well-educated, and prepared to be thriving adults. So thank you again for joining us, and now on to the data itself. And with that, it is my pleasure to introduce Alicia Kemlovich, our Vice President of Data, Analytics, and Research, and she's going to run you through a bunch of fantastic numbers.
Good afternoon. My name is Alicia Kemlovich, and I serve as the President of Data Analytics and Research for Indiana Youth Institute. It is a pleasure to be here today to present Indiana Youth Institute's 2021 State of the Child. I echo Dr. Silverman's thanks to those joining us virtually today, and to John Hammond for representing Governor Holcomb, and to the Commission for Improving the Status of Children for co-hosting this event with us. We recognize, the State of the Child provides us a foundation to find ways to share collective responsibility, break down silos, and create ever stronger and growing partnerships to ensure all Hoosier youth can reach their full potential. We recognize that there are many challenges facing our children and youth today. We also recognize that historically disadvantaged children and youth across Indiana, such as our racial and ethnic minorities, our youth with disabilities, our English learners, our LGBTQ youth, and our rural youth, face unique challenges associated with education, health, and economic well-being that impact their outcomes and opportunities. To best serve our Hoosier kids, we need to know who they are. Indiana is home to the 15th largest population of children nationally. In 2019, more than 1.56 million children younger than 18 resided in Indiana. 51.5% of Indiana's child population was male, and 48.5% was female. Indiana's child population is more diverse than the adult population, and the percentage of non-white youth has been growing since 2010. 2020 was a challenging year, but it was also a time for a recommitment to our shared goal of improving the lives of all Indiana children and to ensuring Indiana is a great place for children to grow up with equitable access to the opportunities and resources our state has to offer. Today, we will highlight how Indiana is doing in the areas of family and community, health, economic well-being, and education. Nationally, we have a few bright spots, but we are also lagging the rest of the country in certain data indicators. Indiana is ranked 29th for overall child well-being, and our overall ranking has not changed from last year. We have improved one spot in family and community. We were 32nd last year. Economic well-being is our area of biggest improvement by jumping 9 spots from last year at 24th. We also improved several spots in education. However, our biggest area for improvement is in health, which decreased 9 spots from last year. It's also our lowest ranking area for child well-being. A theme throughout all areas of child well-being in our state is that there are serious disparities in opportunities and outcomes that can be found throughout the data based on a child's place, race and ethnicity, income, disability, or immigration status. Indiana is ranked 31st nationally for family and community indicators. While 2 of our indicators improved in ranking, the ranking for teen birth rates was stagnant, and that for youth living in high poverty areas decreased, even though Indiana's percentage of youth living in high poverty areas went from 13 to 10%. This shows that though Indiana is improving, we are lagging the rate of improvement in other states. We are going to highlight a few key issues in each domain in addition to our spotlight topics. Our first in family and community is children in the foster care system. Our children in foster care are vulnerable youth who have often been impacted by abuse, parental neglect, inadequate housing, the state's ongoing drug crisis, or other factors. Young people who experience foster care report challenges in educational and employment opportunities. According to the Indiana Department of Child Services, 29,287 Hoosier children were in foster care at some point during 2019. In 2019, the majority of foster placements, 45.5%, were in a non-relative home. The average length of stay for children who exited care in 2019 was 584 days. When compared to our neighboring states, Indiana has the second highest number of children in the foster care system. In this year's data book, you will see sections scattered throughout detailing the current and potential impact the COVID-19 pandemic has and will have on Hoosier children and families. The number of calls handled by the DCS hotline in April 2019 compared to April 2020 decreased by 44.3%, which may be due to children being home and not in school with mandated reporters. It may be difficult for teachers and other mandated reporters to determine abuse or neglect virtually. Thus, though the maltreatment is continuing with children being home due to COVID, as well as the other added stressors on parents due to the economic downturn, the incidents are going unreported. In the late 1930s, the federal government graded neighborhoods into 4 categories based in large part on their racial and immigrant makeup. Neighborhoods with minority and immigrant occupants were marked in red or redlined and considered high risk for mortgage lenders and undesirable or hazardous places for people to live. Formerly redlined neighborhoods in Indiana still tend to be home to large minority populations and display the most persistent inequality. The current poverty trends in Indiana reflect the historical patterns of the neighborhoods with greater rates of poverty. The image on the right of the slide illustrates poverty in Indianapolis at the census tract level from 2016. As you can see, the areas with higher rates of poverty are the same ones that were denoted as less desirable and redlined in the 1930s. Out of 274 cities in the United States ranked for racial inclusion, Indianapolis ranks 229th, again illustrating that the segregation of the past continues to today. Additional information on Indiana's other cities is available in the data book. As segregation in cities and neighborhoods by race and/or income can lead to segregation within and between districts and schools, ways to leverage these data include correlating housing policies with educational policies. Again, additional ways for both ways are expounded upon within the data book. Our spotlight issue for family and community in this year's data book is youth in the justice system. As of July 2020, 335 youth in Indiana were in an Indiana Department of Correction juvenile correctional facility, where 50.9% were committed for a violent crime. This has dropped by 23.9% since July 2017, when nearly 400 juveniles were in facilities. The majority of youth, as of July 2020, were male, with the average age at intake at 16. Among juveniles committed to an IDOC correctional facility, the most common offense is against a person, which includes direct physical harm or force. The next most common offense is property crime, which includes burglary, theft, shoplifting, and vandalism. Indiana's youth justice Indiana's youth justice data illustrate racial and ethnic disparities of the youth involved with the system, as there is an overrepresentation of youth of color in Indiana's youth justice system. The data for justice-involved youth skewed disproportionately towards Black youth as compared to their total representation of Black youth in Indiana. Youth who are juvenile offenders are particularly vulnerable to academic challenges and failure, subsequent involvement in the justice or other social services system, and sustained poverty. Youth who were involved in the justice system during their childhood have a high likelihood of reoffending and relapsing into criminal behavior that results in rearrests. 29.6%, or about 1 in 3 juveniles released in 2016, returned to incarceration in 2019 either as a juvenile or adult. Of the juveniles who returned in 2019, approximately 96 were returned for a new crime. To assist local, state, and national leaders, we provide ways to leverage the data throughout the 2021 data book to help improve the outcomes for all children. On the slide, you'll see a highlight of some of the ways to leverage the family and community data. To focus on one way to leverage the data regarding youth justice, we encourage local communities and youth-serving organizations to adapt programs for at-risk youth for the detention facilities. Through careful examination of existing funds, local schools, youth-serving organizations, and communities can direct resources to adapt successful programs serving at-risk youth in schools or out of schools for youth in detention facilities. The Jobs for America's Graduates, or JAG program, is one example of an evidence-based program supporting at-risk students in high schools that communities could adapt to support their justice-involved youth. In 2019, there were some economic bright spots. The percentage of Hoosier children in poverty decreased, improving our national ranking, and fewer households with children experienced a high housing burden. Though COVID has not hit Indiana as hard as some other states economically, we do know that the pandemic has exacerbated all of these economic indicators and increased financial hardships for all Hoosier families. There are, however, significant disparities across racial and ethnic groups, with all Indiana youth of color experiencing poverty at a higher rate than the state average. The two images shown here show the rates of poverty when comparing children in poverty within their racial ethnic subgroups and comparing children of color to all Hoosier children in poverty. Both images reveal disproportionality in Indiana's poverty rates. The image on the left shows the percentage of subgroups that are poor. It compares the poor population of a subgroup to the entire population of that subgroup, such as kids that are two or more races living in poverty compared to all kids who are two or more races. We can see that youth of color have higher rates of living in poverty when compared to their white peers. Disproportionality similarly emerges when comparing the poor population of a subgroup to the total youth in poverty population, such as kids that are two or more races living in poverty compared to all youth living in poverty. When comparing these rates to the population representation, disproportionality again emerges, as there are higher rates of youth in poverty that are a racial or ethnic minority than white. As you can see, the COVID-19 pandemic is impacting households with children economically. Loss of employment or outcome may exacerbate challenges facing low-income youth, such as food insecurity, attending school and work commitments, consistent access to broadband and a personal computer, academic struggles, special needs support, and access to health professionals and mental health care. Annual child rearing expenses vary by household income, location, and size. One major expense is infant and child care. Nationally, child care and education, including the cost of daycare, school, and after-school care, is the third largest expense for families. Indiana ranks 18th for the most expensive infant care in the nation. The average annual cost of infant care in Indiana is $12,612. Infant care for one child would account for 22% of Indiana's median income. In today's State of the Child, we will examine data from one economic security program, Temporary Assistance for Needy Families, TANF, or formerly welfare. Of the total TANF spending, about 3.6% of the total funding goes to cash assistance for families and children. In 2019, 5,235 families received TANF cash assistance. The monthly cash assistance for TANF of $288 for a family of three, as well as the income eligibility, was set by the state in 1988. The majority of Hoosiers who benefit from TANF cash assistance are children. 78.2% of TANF recipients in September 2020 were children. Though our TANF rates are declining, we may not be meeting the need. It is estimated that for every 100 families living in poverty in Indiana, only 6 receive TANF. The national average is 22. We provide 3 ways to leverage these data in the data book at the state level: to examine the cash assistance level, to expand income eligibility guidelines, and to increase data transparency by disaggregating data by race and ethnicity, gender, age, and county in the state's monthly reports. Our economic well-being spotlight for 2021 is on the wealth gap. While income is a beneficial metric to understanding financial and economic security, it is a static and near-term measure that does not signal long-term stability and financial worth. Wealth is comprised of multiple assets and is cyclical and multi-generational. The transferal of resources between generations contributes to a child's family's wealth and helps build their assets throughout their lives. Wealth affords young adults with opportunities to take risks without fear of failure due to their safety net from their families. Youth who live in families with less wealth have limited financial security, which can create stress and upheaval in their lives. Wealth also helps cushion families from economic shock. Without assets and savings, families may be just one crisis away from financial disaster. Wealth delineates families who are economically secure and those who may be, but only for now. Income also contributes to building wealth. Indiana's median income for 2019 was $57,603, the 38th highest in the U.S. As you can see, Indiana's median income varies for different racial and ethnic subgroups. When disaggregating household income by race and ethnicity, disparities are evidenced as the median income for Black households is 37% below statewide median income and 40% less than white households. The median Hispanic household earns 21% less than the median white household. The wealth gap is a product of historical, social, institutional, and political factors. The ripple effects of historical policies and events, such as redlining neighborhoods and cities, the destruction of Black Wall Street in Tulsa, Oklahoma, and the slow eradication of the Avenue here in Indianapolis, impacted generational accumulation of assets by families. In 2019, white families in the U.S. had 8 times more wealth than Black families and 5 times more wealth than Hispanic families. In addition to our nation's historical policies, present social and economic factors influence the wealth gap throughout the U.S. and in Indiana. These factors intersect with the overall economic well-being, health, and education of children. Homeownership is often the primary way families begin to build their wealth. When disaggregating owned housing units by race and ethnicity, meaning how many houses are owned by different subgroups, disproportionate disparities emerge. For example, 91% of homes in Indiana are owned by white Hoosiers, though 82.8% of the population is white. Black residents are 9.6% of Indiana's population and Hispanic residents 7.2%, but only 5.2% and 3.9% of homes are owned by these subgroups respectively. An additional factor in wealth is savings, including retirement, college, and general accounts. Though we do not have the quantified data of Hoosier savings, we do know that nationally, Black students are more likely than their peers to rely on loans to finance their education. Additionally, at the national level, 29.9% of white families in the U.S. received an inheritance compared to 10.1% of Black American families and 7.2% of Hispanic American families. For Hoosier children's economic well-being, the following are highlighted as considerations as ways to leverage the data. Our recommendation that we will take a closer look at today is expanding how the state defines poverty and low income and funding policies. The state provides additional funding to schools and districts through the complexity component in the basic grant for student tuition. Beyond the current 3 indicators of complexity, such as that are SNAP, TANF, and or being in the foster care system, the state can study additional factors that indicate the wealth, such as homeownership or parental educational attainment, to better understand the financial stability and prosperity of families, as well as give resources to meet students' needs. Access to high-quality education throughout a child's life is foundational to their success. Indiana's ranking in education in 2019 was 15th in the nation, an increase of 6 spots from last year. Our lowest ranked data indicator, however, is the number of children ages 3 and 4 enrolled in school. Pre-kindergarten, or pre-K, builds young children's social emotional readiness, self-regulation, attention, and cooperation. These skills are foundational for success during children's school years and in later life. Children who attend preschool are more likely to be more prepared for kindergarten than their peers who do not attend preschool, thus reducing children's future gaps in academic proficiency. Less than half of Indiana's children ages 3 to 4 are enrolled in preschool in 2019. Beginning March 15, 2020, Fafsa applications began to decline. Though application numbers rebounded in April of this year for the class of 2020, applications for the class of 2021 have declined by 12.3% as of December 2020 when compared to the last academic year. The decline in FAFSA applications is sharper in high minority schools compared to low minority schools. Additionally, high schools in Indiana's towns and cities saw more pronounced declines in FAFSA applications submitted for the class of 2021 compared to rural and suburban areas. Low-income schools that are Title I eligible in Indiana have had declines of 15.5% of FAFSA applications compared to 9.6% of non-Title I schools. Because of future earning potential, post-secondary education is becoming increasingly necessary to obtain careers with self-sustaining wages. The state has continued to recognize the importance of post-secondary education through a variety of policies and initiatives. The 60% goal of Hoosiers with post-secondary attainment by 2025, the You Can Go Back program, workforce ready grants, and graduation pathways. 61% of Indiana's high school graduating class of 2018 enrolled in college within 1 year. Students who earned an honors diploma were more likely to enroll in college than students who earned a Core 40 or general diploma. Rural students attended college at a lower rate at 57% compared to their non-rural peers at 62%. In the 2021 data book, we expanded our career readiness section to include more data on career and technical education. With assistance from the Governor's Workforce Cabinet, the 2021 data book now has data about CT enrollment, pathways, dual credit, and work-based learning. During the 2019-2020 school year, 64.3% of high school students enrolled in at least one CTE course. As the images show, engineering has the highest number of enrolled students and of students earning dual credit. In 2019-2020, about 1.8% of the total number of students enrolled in a CTE course earned an industry certification. A child's third grade reading level and eighth grade math proficiency correlates with future educational performance and success. Students who are proficient readers in third grade graduated high school and attended college at higher rates than their peers who were below grade level. Indiana utilizes two standardized assessments to evaluate students' proficiency of academic standards: iRead3 for third grade reading and iLearn for eighth grade math. Data in this year's data book for both iRead3 and iLearn are from the 2018-2019 academic year, as neither test was administered due to COVID. In 2018-2019, 87.3% of third grade students passed the iRead. Though Indiana's overall third grade reading scores appear high, disaggregating these data show significant opportunity and achievement gaps for historically marginalized students. Students in special education, students who are English learners, and students who receive free or reduced price meals are less likely to pass iRead3 than their peers. In 2018-2019, 38% of eighth graders met the level of proficiency on the Math iLearn assessment. 1/3 of eighth graders scored below proficient, and 28.1% were approaching proficiency, both of which signify that around 2/3 of Hoosier students did not master the eighth grade math standards. When disaggregating math proficiency by student subgroups, disparities in the achievement emerge along similar trend lines of Indiana's other assessments. Students of color and students in special education have disproportionately lower achievement rates when compared to their peers. Here are some ways to leverage the data from the education domain. Diving deep into one of those considerations today, implementing a pre-K through third grade approach would help sustain the benefits of high-quality pre-K through elementary school for children. Some features of this approach are aligned curriculum standards and assessment from pre-K through third grade, consistent instructional approaches and learning environments, a kindergarten readiness exam that provides valid, reliable, and comparable data, and availability of pre-K for all children ages 3 and 4. Our final domain today is health. As discussed earlier, health is Indiana's lowest ranked domain at 35th in the nation. Our two biggest areas of concern are overweight or obese children ages 10 to 17, a percentage that has steadily been increasing since 2016, and the number of children without health insurance. In 2019, there were 80,851 live births in Indiana. Indiana's overall infant mortality rate is improving, but disaggregated data showed stark disparities for Black babies in Indiana. In 2019, 527 Hoosier children died before their first birthday. Black women in the U.S. are 3 to 4 times as likely to die from pregnancy-related causes than their peers. In 2019, the death rate in Indiana for Black mothers was 65.4 per 100,000 live births, which was higher than both the national average and the rate for white mothers, which was 61.6 per 100,000 births. COVID has shown increases in children and youth having anxiety, depression, low self-esteem, and distress due to the social isolation and economic conditions. Of those with children in the household in the past 7 days, 10.6% indicated receiving counseling or therapy from a mental health professional. Indiana is ranked 28th for the prevalence of mental illness among youth. 10.2% of Indiana children ages 3 to 17 have been diagnosed at some point in their lives with an anxiety problem. Nearly 4 out of every 10 grade 10 students reported feeling sad or hopeless for 2 or more weeks in a row. 30.7% of all college students in Indiana reported feeling sad or hopeless in the past year, with 12.1% seriously considering attempting suicide. And nationally, 39% of transgender youth experience serious psychological distress. Family support and response can be a critical contributing factor in transgender youth's mental health. As we don't have data for LGBTQ youth in Indiana, one way to leverage the data suggested in the data book is to increase the disaggregation regarding youth and mental health to include income, insurance coverage, race and ethnicity, age, gender, ability, sexual orientation or identity, native language, and locale. This can occur through increasing self-reported data via surveys or expanding the options for other varying characteristics. Children who are overweight or obese face a greater risk of chronic health conditions, such as type 2 diabetes, some cancers, and heart disease, compared to children who are at a healthy weight. Factors such as poor diet quality, excessive sedentary time, inadequate physical activity, stress, and sleep deprivation also place children at an increased risk for these illnesses. Obesity also threatens to shorten the life expectancy of children. 8.7% of Hoosier children ages 10 to 17 are underweight, 54.7% are normal weight, 19.9% are overweight, and 16.7% are obese. Indiana's obesity rates for children and teens has been steadily increasing over the past few years. Indiana was previously ranked 23rd in the nation for children's obesity in 2017. The state fell to 38th in 2018, indicating that not only is Indiana's rate of childhood obesity increasing, but other states are improving more rapidly comparatively. Hoosier youth's use of cigarettes is lower than the national average in 2020. 4.4% of Indiana youth between grades 9 to 12 reported smoking cigarettes in the past 12 months versus the national average of 7.8%. The smokeless tobacco use rate among Hoosier youth was 2.3%, which was also lower than the national average of 5.5%. Among Indiana high school students, though, the most frequently used tobacco product is electronic vapor products. In 2020, the percentage of students reporting monthly use of electronic vapor products decreased across all levels from the previous year. However, use of electronic vapor products among Indiana youth is above the national average. 17.1% of Indiana youth grades 9 to 12 report using electronic vapor products versus the rate of 13.2% at the national level. Childhood vaccinations and preventive care often detect and prevent conditions and diseases in their earlier, more treatable stages, significantly reducing the risk for potential illness, disability, early death, and expensive medical care. In 2019, 70% of Indiana infants ages 19 to 35 months old received the full vaccination series, which increased by 14 percentage points from 2015. 1.3% of kindergartners, or about 82,000, had an exemption for one or more vaccines, and 0.3% were due to medical exemptions. In 2018, 60.8% of children ages 12 to 17 had one or more preventive medical visit. 39.2% had no preventive medical visit. Disparities in preventive visits emerge when disaggregating the data by family income level. Preventive care access directly correlates with income level, with those families with greater income accessing preventive care at a higher rate than families of a lower income. In particular, those families who are in extreme poverty, or 0 to 99% of the federal poverty level, have the lowest rate of preventive care, though these children and families are eligible for traditional Medicaid coverage. Many historically marginalized subgroups of youth face barriers to obtaining vaccines and preventive care. Undocumented immigrants lack access to health care because many are uninsured, reflecting limited access to employer-sponsored insurance and eligibility restrictions that bar them from participating in Medicare, Medicaid, CHIP, and the Affordable Care Act marketplaces. For many in the Black community, America's history of medical trauma based on race and ethnicity has created more distrust of medical scientists, treatments, and vaccinations than other groups. Access is a critical barrier that may impede the rates of vaccinations and preventive care for rural children and families. The overall ratio of population to primary care physicians in Indiana is 1,510 Hoosiers to every one primary care physician, with our rural counties having higher ratios than urban and suburban counties. Ripley, Pike, Union, Ohio, and Newton counties have only one primary care physician for the entire county. LGBTQ youth often face challenges and barriers to accessing needed health services, and as a result can experience worse health outcomes. These challenges can include stigma, discrimination, violence, and rejection by families and communities. To leverage the health data from the data book, we offer the following considerations. One that I'll focus on right now is the removal of the 90-day waiting period for youth switching from private insurance to CHIP in state regulations. State policy requires a 90-day waiting period for a child or youth switching from a private insurance, such as employer-based insurance through their parents' work, to CHIP. Ostensibly, Hoosier children switching from employer-based insurance to CHIP are uninsured during that 90-day waiting period and will not have any coverage for any immunizations, checkups, screenings, or emergencies. By removing this state-issued policy, the state helps guarantee that all qualifying children and youth obtain health insurance to increase access to preventive care and immunizations, particularly during the current health crisis. IYI is here to be your partner and ally. We want to find ways to work together to positively impact the lives of youth. The Kids Count data book is officially released and available on our website, where you can find these data and much, much more. In addition, county snapshots for all 92 counties are also officially available. Thank you for your time and the work you will do.
I want to thank you, IYI, for that great presentation, all the amazing work you do every year to gather the data and put it in a form that's understandable for all those who are working for the benefit of our kids and families. At the Children's Commission, we really strive to promote best practices and policies that will help our vulnerable youth and families and that are based on good data and research. And the Kids Count data book is really a key input in that process. So thank you for that. Thank you to everyone who has tuned in today to this broadcast. We will have a recording available. Not sure if it'll be on IYI's website or the Children's Commission website, maybe both, but check it out. I definitely encourage you to go to the IYI website and download these great resources. You can read, like if you're a huge data nerd like me, you can read the whole data book from cover to cover. If you don't have that much time, you can just read the summary, and definitely look for the data from your own county. I also want to invite you, if you haven't ever done so before, I want to let you know that the meetings of the Commission on Improving the Status of Children are open to the public. In pre-COVID times, you could walk into the room. We're not meeting in a room currently, but our meetings are webcast on the Children's Commission website. The next Children's Commission meeting will be on February 17th from 10 a.m. to noon. That's a Wednesday. And you can find the link to watch it live on the Children's Commission website. And I'm going to give you that URL. It's in.gov/children. So 2 websites to visit as you have time. For the data, IYI.org. For more on how your state policy leaders are taking that data into consideration and trying to promote better practice for youth and families, visit the Children's Commission at in.gov/children. Thank you and enjoy the rest of your day.